Well, hi, everyone. Welcome to the MGMA Business Solutions Podcast. I'm Daniel Williams, Senior Editor at MGMA. And today we're discussing a really interesting topic I want to get to the bottom of: smoother operations and smoother care. So to elaborate on that topic, joining us today are two people from NetSuite. We've got Kate Daniels, Senior Director of Franchises, Associations, and Buying Groups. I want to ask Kate what that is exactly. And we've got Hyrum Gray, Solution Consulting Manager, also at NetSuite. So, Kate, Hyrum, welcome to the show.
Thank you. Lovely to be here.
Yeah, it's great having y'all. So we talked about this offline. Kate, I'm going to start with you. Both of y'all have very interesting backgrounds, but for the sake of focusing on the topic, we'll limit some of the background, but I would love to hear this. So, Kate, let's begin with you. Just tell us a little bit about your healthcare journey, what got you to NetSuite, and anything else you might want to share.
Sure. Lovely. Yeah, today I lead a program at Oracle NetSuite called FAB, and that stands for Franchises, Associations, and Buying Groups. And it's predicated on the notion that we trust our friends and our peers and our colleagues far more readily than we do strangers. Okay. And I think that's kind of a human thing. But I started my career 20 years ago, in 2005, in a rural health center in South Africa. Wow. So while much of what I say today will be sort of driven by and informed by my early exposure to healthcare and to a dearth of medical systems and back-end systems to support healthcare delivery, I'll certainly lean on Hyrum for more of the technical backing.
Yeah, perfect. And that's one of the things when, we go to LinkedIn now and learn about people. I'm going, wow, Kate has this amazing background in South Africa and all these other things she's been doing. But thank you for sharing that. Hyrum, wanted to hear from you as well. Tell us a little bit about your background and what brought you here.
Yeah, my background started out in corporate accounting. I graduated in accounting and then went into the corporate accounting field. And I worked in that for quite a few years. And then after that, I actually left the accounting world and went into the entrepreneurship world. And I ran an e-commerce business with my wife for 5 years. And that was incredibly fun, seeing all different facets of business. And then we sold that business. And then I came here to NetSuite back in 2020. And when I came here to NetSuite, the healthcare industry was really in high demand, especially for NetSuite, as it has remained to this day. And so I started out in healthcare when I came here to NetSuite, focused on that industry, and been in that ever since. So very happy to be here.
Yeah, and so I want to give a little background for our audience Oracle obviously is one of the biggest companies in the world, but Oracle NetSuite, let's talk about that. Kate, I'll start with you. Just tell us a little bit about how that Oracle NetSuite interacts or helps medical practices and the work that they do.
Yeah. Well, NetSuite has for quite a long time, been the preferred cloud-based enterprise resource planning or ERP solution for the healthcare industry. Okay. This is because we marry quite nicely with health record systems. We can ensure HIPAA compliance and HIPAA adherence, which is critical to anybody controlling the continuum of care. But, one of the reasons we're here is we have a strong relationship with the Medical Group Management Association. And since fomenting that relationship about a year and a half ago, they have quickly risen to be one of the largest and most notable relationships we have under this association's program, and that's driven by the members. Members are adopting NetSuite en masse because NetSuite's the way to scale your healthcare operation. We're finding that members are maximizing the integrations that we offer with hundreds of different sort of gap-filling SaaS products, and we find that members are delighted to have an option available to them that kind of takes them out of the world of never-ending spreadsheets and kind of analog, slow, cumbersome systems. So, yeah, this relationship has been one that's not only allowed us to kind of feature what we do for the healthcare industry, but to deepen our relationship with a community of highly self-referential healthcare providers.
Okay, thanks for that. Hyrum, anything you want to add to that discussion?
Yeah, I mean, NetSuite, just like Kate said, it is a full business suite, and it really has a tremendous amount of different capabilities, but it can do so much more. And specifically in the healthcare space, historically, healthcare companies, they separate the operations and the accounting into two siloed different places. NetSuite can really join that. And so one thing that NetSuite really does well is it takes data from the EMR, the patient billing platform, and can bring it into NetSuite, and it can bring it in with so much rich data. One example of that is bringing in revenue data, and you can bring it in a segmented way into NetSuite. And when I say segmented, I mean that you can bring it in with which location it happened at, which department, which provider or physician, which pay type, which insurance carrier. On top of that, it can bring in inventory data. So what was used during the patient visit, what was used when it left the central supply warehouse. On top of that, it can bring in statistical information. So how many patient visits happened, how many referrals, how many child versus adult visits. So just a lot of rich data that NetSuite can marry between the operations and the finance side.
Okay, thank you. Kate, I'll turn back to you. So one of the things we want to get to the bottom of is really marrying these medical practice with the technology that's available to them. When I was doing research and looked at y'all's backgrounds, one of the things I saw that manual processes like budgeting and reporting are still common in healthcare. I know and your eyes and your reaction show everything here. So let's talk about the outdated methods that may be there, how they create barriers, and how we can bring those practices to utilize the tools that are available to them out there.
Yeah. Well, I will draw a bit on some of my early experience, which is why my eyes lit up in such a way. I mean, when I first started my career, which was back in 2005, I went to work for a privately held but PEPFAR-funded clinic. So PEPFAR was the President's Emergency Plan for AIDS Relief, initiated by George W. Bush. And this was to address, serious HIV infection and tuberculosis infection, largely in emerging and frontier economies. So working in a private clinic that was receiving all of this support around antiretrovirals was a really good way to expose oneself not only to global healthcare and public healthcare issues, but also to the systems and support that undergird all of that service delivery. And I was shocked, being a person originally from Northern California whose mother was a certified Microsoft trainer. So it was imparted on me early how important it is to be conversant with Excel and Access and other types of systems like that. But I was shocked by the dearth of strong back-end systems in this clinical setting. In fact, managing a pretty large rollout of ARVs at the time, this was, again, back in 2005, we were managing that on a massive Excel spreadsheet.
Wow.
Which today, I mean, I think we can all agree that would be a irresponsible and perhaps a bit risky way to manage confidential patient information. And I don't think any of us would dream of it. But, I think that the origin stories for a lot of the ways we think about data and patient care today matter. So I think the extent to which you want to protect and steward patient information and the patient continuum of care is inextricably linked to the systems and the tools you have to back up those processes.
Okay.
So, yeah, I'll hand it to Hyrum to talk a little bit about exactly how NetSuite integrates with some of the systems we see most commonly. But I think the two are the continuum of care and the systems you use to administer that care are cannot be divorced from one another.
Right. Thank you for sharing that. So, Hyrum, I'll tweak it just a little bit. So when you're looking at the medical practices, what are some of the measurables? What are some of the KPIs that you're looking at to see how a medical practice's back office systems are holding them back?
Yeah, so medical practices, clinics, hospitals, FQHCs, they really want to be able to plan and forecast, based off of headcount, based off how many visits they're getting, based off of the inventory that they need to have on hand. And all these different systems are often siloed. And so NetSuite can really bring that into one unified system, particularly with planning, budgeting, forecasting. And if you know that you need to start hiring more people, well, how are you going to plan for that? How are you going to budget that? NetSuite has a tool called NetSuite Planning and Budgeting. Every company out there, every organization, planning, budgeting is important to them. With MGMA, I know that they work a lot with nonprofit healthcare organizations. Nonprofits, they're typically federally funded or funded by the state, and they need to manage their funds extremely well with a lot of care and a lot of thought in that. And NetSuite can streamline that process, getting the data from one side to the other in real time and allowing them to have that visibility across it.
Okay. Thanks for that. Kate, want to talk about automation and using a unified platform, because a lot of times, and I know I am guilty of this right now, I've got some platforms I do some of my work on, and then I'm over here, and then I'm over there, and I know that there are some that can integrate, but let's talk about using that unified platform, how it can help workflows, reduce bottlenecks, really make things work the most efficiently.
Yeah. I think you're best positioned asking Hyrum that question. Honestly, I think Hyrum can speak to some of our specific integrations for healthcare and as well as the workflows we've seen most successful for some of our healthcare customers.
Yeah, I mean, streamlining processes and having things in real time and automating your processes is key. I'll give you one example. I recently worked with an organization. They had 4 different teams doing the procure-to-pay process. The procure-to-pay process is, how do you request supplies? How do you buy those supplies? How do you put them into inventory? And how do you pay for those supplies? This organization, they had 4 different teams doing that on 4 different systems. A lot of it was just manual. So, for example, the people that needed the materials, the supplies, they were emailing, they were handwriting, they were calling the purchasing team saying, we need these supplies. The purchasing team would get that, and then they would make the order. The order would arrive at the warehouse. The inventory team would receive that into inventory. They would get the bill of lading. They would scan that in, send it over to the accounts payable team, the 4th team in this process, and they would pay the bill. These were all siloed. They couldn't view what the other team was doing. NetSuite, that is standard functionality. You can automate that process. You can have somebody electronically going in, making a request for supplies. They can electronically receive those supplies. You can have an approval process around it. So it really makes everyone in the organization more efficient, and this drives to better care in the end. So,
yeah, I really appreciate that. So I'm going to shift gears just a little bit, Kate, and ask you a question about change management. So full disclosure, MGMA, we're coming up on our 100th anniversary, our 100th year. It'll be in 2026, so we're really excited about that. But to do that, we're going through some change management. And as you know, there can be friction, there can be resistance, there can be just like what's going on. So when we talk about change management, what strategies can help ensure, or at least help grease the wheels, so to speak, that staff buys into it? Because we get really comfortable in what we're doing, and then even though this might be better, this change, it's still change. And so it's uncomfortable initially.
Oh, yeah. I mean, this is, I think, the most important component of any digital transformation journey that any health center, health clinic, hospital will undertake. I think sometimes, and it's led by people in our position, we lead with the technology as if the technology is going to solve all your problems. And it won't. Our technology is great, as is many other pieces that we work with. But I think the key is, if you lead with the tech, you'll get the most important components wrong, which is the people and the processes. So any change management journey begins with ensuring you've got the right people on board and you've got the right people bought in to the change you're initiating. People have to feel like this thing that will be shifting is going to improve their jobs, the output of what they're doing, and potentially their impact. At the end of the day, we all want to feel like we are impactful in our work. We want to feel like we're making a difference and that we are being as efficient and as strong a steward of resources as possible. And so ensuring that you're gathering and generating buy-in and momentum from the people who will be affected is the first step. And then you have to design and put in place the processes that will support those people. Only then, in a tertiary fashion, do you talk about the technology. It should be the last part of an otherwise pretty broad and thoughtful change management process. And I think when we do talk to customers who've stumbled during their implementation or whose expectations were not managed carefully, it's generally around these issues. We didn't have the right people bought in from the beginning, or we didn't have the right processes to support the wide-scale adoption of this new technology. So I think if we are driven by this kind of people, process, then technology in that order mindset, we will position our customers to succeed.
Hyrum, I'll turn it to you, and maybe we take a step even deeper if you want to give an example or what it looks like in healthcare, but we're talking about almost a math equation, people, processes, technology, success at the end of that. But walk us through that. What's going on and where are those friction points? How do we get around those?
Yeah, so when you are trying to implement new software, new technology inside of your clinic, your practice, I think there are two main things that can really help organizations and two things that maybe they do incorrectly when they're trying to change. One is the implementation process. A lot of people are so anxious, they're so excited to get onto a new system that they rush that implementation process. I think that they need to slow down, take it easy, take the time to really implement the software and do it right the first time. That will be the foundation. Hopefully it's the foundation that lasts a decade plus that you're using that software. So don't rush that process. The second thing that I would say that they need to do is adoption management. So getting their team to buy in to this new software. And the great thing about NetSuite is that can start immediately during the implementation. So before you go live, you don't want people learning the software when it's live. You want them to learn the software before you're fully implemented. You want them to be practicing, training, getting comfortable and familiar inside of that system. So the two things, don't rush the implementation and get your people practicing and learning it immediately before it goes live.
Okay. So I'll give you all kind of a blank canvas then for a final question. Hyrum, I'll stay with you and then we'll go to Kate for this. You kind of gave a really good piece of advice for healthcare leaders knowing, when they need to modernize their operations but aren't really sure where to start. So you can continue in that mode, or if there's something else you'd want to share with these MGMA healthcare leaders, they're looking at technology. They see a lot of options out there. They see the challenges they have. Where do they start? Where's something that they can look into where they can get some wins and they can move forward with their organization?
Yeah, so the first thing that I would tell them to do is to go down to the operations people, the people that are actually performing the transactions inside of their current system today. Ask them what their bottlenecks, what their challenges are. Oftentimes leaders, they can maybe feel like we're going to save money by staying on this outdated, very cheap and expensive system. So one recommendation is go talk to your people, see what challenges they're having, and then make the jump to a new system. The new system is, of course, probably going to be more expensive up front, but in the long run, it's going to really save them money. There's a great quote by Abraham Lincoln about chopping down a tree. He says, if you give me 6 hours to chop down a tree, I'll spend the first 4 hours sharpening the axe. So you're not going to save time by using a dull axe. Spend the money, get the sharp axe, and it's going to pay off in the long run.
Love that. Kate, I'll give you the same question, and you can take it in whatever direction you want, but we've got these medical practice leaders. They have a lot of complex challenges technologically, staffing-wise, everything else they're dealing with. So where would you advise them to really begin? What are those first steps they need to do to really, if they know they need to modernize their practice, but are kind of that paralysis by analysis, they're just stuck there right now?
I'd love to kind of highlight and piggyback off of Hyrum's idea. I really appreciate you starting with that, Hyrum, because I think so often big decisions, especially expensive ERP transitions, are made in rooms that don't involve the people who are everyday implementers or patient-facing. And I think asking those questions of the people who are patient-facing and who are going to be most directly affected by changes is a great place to start, right? Get buy-in. Again, ask all of the ranks and the levels of people most affected by these changes. The other thing I think is important is, your community of healthcare providers and practitioners is a really rich resource of recommendations and ideas. A lot of the MGMA members have been exposing themselves to NetSuite as well as other systems and made the choice to adopt NetSuite. And they're now going through implementation, they're going live, and they are a rich repository of experiential information, words to the wise, tips and tricks, things they wish they'd asked earlier on, things they wish they'd done earlier on. So I think ask your community, lean on the leaders also of MGMA who have been, for us, incredible partners, not only in the conversation around digital transformation, but in the broader conversation around how to serve their members well. So I know they have a vested interest in ensuring there's good connections made between members and that the information shared is of true value. So, start with the folks who are most directly affected and are faced with patients every day, and lean on your community of peers and colleagues.
All right. Well, Kate, Hyrum, thank you so much for joining us today. I really appreciate y'all being here. And I should have mentioned it previously, but they're in studio with us here. So it's great to have y'all in here.
Yeah, it's great to be here. It's been a pleasure.
It's delightful to finally have the 3D experience, I find. So much of our lives are, Hollywood squares on a screen, and there's nothing quite like being in person. So thank you.
Yeah, we all live in the greater Denver area, but came from all parts of it to get here today. It was really neat meeting up with y'all. So with that said, everybody, that's going to do it for this episode of the MGMA Business Solutions Podcast. I do want to say if you've got questions, thoughts, want to do more research on what Hyrum and Kate were talking about today, go over to netsuite.com. I'm going to provide a direct link in the episode show notes so you can find exactly what you need there. So until then, thank you all for being MGMA podcast listeners.